more about our families and how we can do better. And Cindy's been working on this very assiduously and is reaching the end of her PhD, and will be presenting that for examination in the next couple of months, I think. But I think that the remarkable thing is that with such few resources, really, that a great body of work is emerging, which is really going to push us in a new direction. So we're not just talking about drugs now and treatments. We're talking about actually the way we do our clinics, the way we interact with our parents, and the information they get, and this is all due to the hard work of Cindy. So Cindy, tell us what you've done.
Hi everybody, thanks Steve. I'd like to open by acknowledging the recognition that AREST CF has for the importance of family and the psychosocial environment of children for their health and development. And based on that premise, I'd like to talk about 3 of our research projects. Firstly, I'll talk about parents' experiences of the early surveillance program. So that was that list of procedures that Steve showed in the beginning: the CT, scan, bronchoscopy, infant lung function testing. So those procedures that occur around that annual review. What we did here was to speak to parents, and we asked them these general questions, and we did that in an interview-style format, and then we analysed that interview data. The next project I'll talk about in terms of the findings is our information needs and priorities of parents who have newly diagnosed infants. What we did here was to develop and validate a questionnaire that we're now using to conduct a multi-centre national study. This project looks specifically at the formal education and training of cystic fibrosis. So that's not the diagnosis of CF itself, it's that formal training, usually as inpatients at the hospital. There's plenty of research around and knowledge around the diagnosis period, but there's not very much around that formal education period. In terms of the development of the questionnaire, we had to follow a number of stages. Part of that was to consult with a number of people. We spoke with clinicians and allied health professionals in CF and psychology. We also consulted with our consumer reference group, who consists of a number of parents who have children with CF and an adult who has CF as well. We felt that we needed our research to be informed by parents and not just impose our own ideas and perspectives onto the questionnaire. The last study I'll talk about is our psychosocial determinant study. What we did here was to collate a number of questionnaires that look at factors within the environment of the child, so family, psychosocial, socio-emotional, environmental factors. And we are analysing that against the clinical data of our children. So we're looking for any relationships between those psychosocial data and the clinical outcomes. We then want to know if there are any relationships. What we want to look at then is, does modifying any of those psychosocial factors then modify disease progression and severity? So I'll talk about some outcomes from each of those studies. First of all, in terms of the annual surveillance program, we found that parents experience anxiety. There's 2 reasons for the anxiety. Firstly, parents who have younger children seem to experience anxiety around the medical procedures. So that's anxiety on the day of the annual review. Whereas parents of older children seem to have more anxiety around receiving those test results on the annual basis. And there's a number of reasons why we think this might be happening. We also found that parents can feel judged. That's because the progression of disease may be seen as a failure on behalf of parents because they are the primary carers, because of that home treatment component of cystic fibrosis. We also found that parents felt empowered by knowing about their child's health and well-being. The parents wanted to know how their children's health was tracking. They felt empowered by having this information. It helped them to act in a proactive manner, which then helped them to cope with their child's CF as well. Parents told us that things got easier over time, and this was because expectations and familiarity was built through experience. Going on to our information needs study, this was the one with the questionnaire that we're now conducting on a national level. We do have some preliminary findings based on the validation of the questionnaire. So parents told us that they favour practical information. They want information that they can take home to keep their child healthy. So that includes feeding, physio and enzymes. They want more information about infection control and lifestyle choices. And they want less information about complex medical information. Parents also told us that they were finding outdated and sometimes conflicting information across state websites. Lastly, I'll talk about our psychosocial determinant study. So what we found here is that markers of hardship, and these markers of hardship refer to the psychological, socio-emotional and child factors. So these markers in families don't seem to be associated with child health outcomes, which is a promising finding for us. However, we did find that socio-economic disadvantage may be associated with lung infection in early life. This could be due to a number of factors, including access to medical care, lifestyle choices. We found that our parents experienced depression and anxiety above and beyond the general population, and stress was also a common factor. What we're now doing is to look at those relationships and try to determine whether we can predict child health outcomes based on any of those factors, those psychosocial factors specifically. So what can we do based on our findings? Firstly, we can provide psychosocial support for families as they embark on the early surveillance program. It's a unique surveillance program in the world. We need to support our families in unique ways. We can provide update and appropriate information to families in the early years. And we can inform Australian websites with up-to-date and appropriate information based on what parents are telling us. Lastly, we can implement psychosocial interventions and support strategies based on family strategies that we ultimately hope will lead to better health outcomes in children with CF and their families. Thanks.
Well, thank you very much, Cindy. Does anybody have any questions for Cindy?
You all want drinks.
Well, we have run a little bit over time, ladies and gentlemen, and I know that Steve has one more presentation to make with regard to the consumer reference group, and so we might move on to that straight away. However, I would just say that CFWA has its AGM on the 1st of April, and notices for that will be going out on Monday. And our guest speaker for that will be the Minister for Health, and he'll be making a very, very special announcement at that AGM. And the 11th Cystic Fibrosis Conference in Sydney from the 15th to the 18th of August at the Sofitel, Wentworth, is coming up, and CFWA is making available 10 $700 subsidies for members of CFWA. And Catherine, if you'd like to stick your hand up. Catherine's the money bags, so she'll tell you how to apply and what the criteria are. So on that, thank you very much, Cindy, and I'll hand over to Stephen.
This is 2 minutes worth of talk, really. We have a governance structure for AREST CF that looks roughly like this. There's a scientific management team, which is the researchers, largely, and the 4 themes that I mentioned earlier on when I talked about the structure of our research, they have people that those themes meet, and they feed into that management team. There's an operations team, Andrew Chong, Andrew's just over here, and Lisa Bennett, and Alexa Williams, who's over there, who are a relatively new team, but are keeping us on track and making sure that we don't break any laws. Our external collaborators are all interact with us through these themes. So we're not really interested in collaborations that are too much out of our line of focus. So somebody might have a great idea, but if it's not about preventing lung disease in young kids, It's an interesting idea, and we might support it, but it's not our main focus. The work packages that we've developed as part of our new CRE, the Centre for Research Excellence, which we're applying for now, they will also feed back through these things. But the important thing here is that we want to make sure that the research we're doing is relevant to consumers. We do get consumer feedback. We have a number of means of doing that. There's an informal group that meets regarding our clinical service. But we want to formalise this a little bit more, and what we're going to do is have a formalised group that might be parcel of the clinical group, but also dealing with research. So the clinical group will also deal with the research aspect. And it'll be led by a trained consumer advocate. And we will be calling for expressions of interest for people to be part of that. And this is the email address that we use for contacting us. We'll probably also have it up on our website eventually, but this is probably the easiest way of getting in contact. And there'll be a call through the CFWA as well. We'll use our various methods of communication to get the call out there. And the important thing is that this will feed directly in, and somebody will sit on this management team, but also on our executive, which has the final say in terms of whether we're spending our money appropriately and for reporting to regulatory agencies and our funding bodies. So this is a very key role. It's a big step for us in the sense that although we've done this informally, we haven't really formalised it and brought it into the governance structure. So this is new. I think it's exciting, and I urge you to show interest if you think that you'd like to be part of it. With that, I'll end. There was a Q&A bit that came up next. If there's any burning questions now, we can field them, but otherwise, informally over drinks. Drinks it is. Thank you very much.